Here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So let's jump right on in there. We've got lots of questions.
Absolutely.
So this person wants to know, I have 3 eye doctors and I've tried everything for dry eyes. Any suggestions?
You know, the fact that she's seen 3 eye doctors probably had a good thorough evaluation. As you know, sometimes we don't have the right answer, the right medication. I would certainly go back to the last doctor and let them know that they're not getting any better. You know, the body only has so many symptoms for just about every disease known to man, so it might take some time to figure out exactly what's going on, but certainly if your symptoms persist, get back to your physician. I know a lot of times just allergies, just dry eyes cause redness in dry eyes, and there's some over-the-counter things that can be done, but certainly get back to the ophthalmologist for complete evaluation, continued evaluation.
Okay. Another question, what's the most common symptom if you tore the meniscus in your knee? And if you did, what can you do to help it?
Meniscus is basically like a shock absorber of the knee. Most patients will have knee pain, swelling, stiffness, maybe even a clicking sound when they try to move their knee. It's very painful typically. You can have a small tear, normally don't do much about it, but as the tear enlarges, you normally have more symptoms. Orthopedists can go in with their fine instruments and clean that up. Sometimes you can start off with anti-inflammatory medications.
Do you have to eventually have surgery?
Not necessarily. You know, a lot of people, they're overweight, they have degenerative knee disease, and it can cause those ribs. They don't necessarily have to get larger or more symptomatic. They can, but just because you have a small tear doesn't mean eventually you will need surgery. We can pick up those small tears normally with MRIs, which are very frequently done.
Okay. What are some natural medications for children with ADHD?
As far as I know, there are none. That whole market certainly is not regulated as well as the prescription medication, so we just ask patients be aware out there. Certainly don't give your child anything that might be dangerous. Physicians like myself, trained in Western medicine, typically don't go to that market to prescribe things to patients. Normally patients do that themselves, so I don't know of anything, quote, natural, end quote, that is good for ADHD.
Okay. This person has been having constant jaw pain for the last week. What could be causing it?
I probably would think of arthritis or some sort of inflammatory condition of the jaw joint. Probably try some anti-inflammatory medicines such as Motrin or Advil. Maybe even consider mild TMJ. I know the dentist here, sometimes they do that for a subspecialty, maybe even evaluation from them. X-rays or CAT scan of the jaw might be a good idea. Sometimes infections and sometimes cancer can present with jaw pain.
Okay. Another one, what kind of doctor do you go to for a busted blood vessel that actually protrudes like a balloon?
I probably would think that that's varicose veins. They have an assortment of physicians who are doing that. Some cardiologists, some general surgeons here locally are doing therapy with laser that helps resolve that. Certainly weight loss and compression stockings also help with that condition.
Okay. Every time I get cold, my hands dry out and crack and peel, which takes about 2 to 3 weeks for the hands, let's see, to actually recover. Is there any way I can prevent this?
A lot of times it's keeping the hands cold. Sometimes it's something else in the environment, so topical steroid creams help a lot. If you're a smoker, certainly don't smoke. Check your thyroid. Certainly that can be a recurring problem.
All right, Dr. Levine, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. This was actually mailed into us. I know. Can you believe it? I know.
Yeah.
Little stamp and
the
everything.
mail system still works.
It does.
Yeah.
This person writes they developed hemorrhoids and they've never had them before. She's 78. Their burning is awful. She's tried preparation H and a hot sitz bath. Is there a medication that will numb the pain instead of just burning? That is the only thing that is very uncomfortable. Will they ever go away?
Yeah, I think she's done a good job. Sitz baths are good. We have prescription medication. They go by a lot of different names. Anusol, HC, Proctafone work really well. We normally like to have them good soft bowel movements. A lot of times we'll throw in a stool softener or something to loosen the stool so that they're not straining. It's a very common problem as we get older, primarily because of constipation, weight gain, sedentary lifestyle will produce those. If the medicines don't work, there's some surgeons here locally doing really good surgery for that. They have to become very painful and bleed and fail medical therapy. So typically they don't go away, but it can be managed most of the time with the topical creams and foams.
Okay. This one, what is endometriosis?
It's a condition where you develop abnormal uterine tissue in the abdominal cavity, very common in the young adult population, can cause a lot of abdominal pain. Normally can take some time to be diagnosed. Sometimes you need surgery. A lot of times it can be managed by medication. The gynecologist typically manage that quite well.
Okay. This person, their right index finger hurts. Sometimes it stays stuck in a bent position. What could it be?
That's a form of tendonitis in the finger of the joint. Sometimes injections are necessary. Anti-inflammatory medicines may be necessary. But listening to this person, she might need a little surgery. The orthopedist hand surgeons here locally can typically manage that very well. You don't necessarily need it, but it certainly is unbearable having to lock your finger in and out all the time like that. It can become very painful as well.
Okay, this person, their right upper back hurts under the shoulder blade, especially when coughing. They heard it yesterday when taking deep breaths along with a popping sound. What could that be?
Probably some form of degenerative thoracic joint disease, arthritis of that part of the back. A lot of times anti-inflammatory medicines work really well. Probably may need an MRI to visualize the spine. Sometimes we use nerve medication such as Neurontin or Lyrica, or even physical therapy to help that situation.
Okay. What does it mean when your heart rate goes up to 160 and your blood pressure goes up and then you feel sore all over afterwards?
Not quite sure if the two are related. Sometimes pain, sometimes infections, sometimes thyroid disease can cause both of those symptoms. Sometimes inflammatory conditions such as lupus, connective tissue diseases can affect the cardiovascular system and the joint system. Certainly these are both abnormal, or all abnormal. Certainly get into your doctor for EKG, blood work, and maybe even some medication to help control the blood pressure and the pulse.
Okay. My son is 16. For the past 3 days, he's had this feeling of being poked by needles or fire ants on his upper body all at once, and it's painful. What could it be?
It sounds like our friend, neuropathy. It presents in so many...
16.
Absolutely. It's so many different ways. Anytime the nervous system gets inflamed or it's injured, you can have that particular problem. It's just trying to figure out where it's coming from and why. Is it a brain problem? Is it a central nervous system problem? So certainly I would go into the emergency room, maybe even the doctor's office, get some blood work, do x-rays of the brain, the cervical spine to try and figure that out. Medicines such as Lyrica and Neurontin work very well for that problem too.
All right, Dr. Levine, as always, we appreciate you taking
Yes,
the
ma'am.
time and stopping by to answer our questions. And you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen. Fax us 892-7305. Email us laf@kftm.com, or you can post those questions every Monday on our KFDM News Facebook page.